Hello, and thank you for joining us today for the second half of our webinar series entitled A Public Health Approach to Gambling, Theory and Practice. My name is Alex, and I'm a Knowledge Translation Assistant working on our public health projects here at GRIO, and I'll be moderating our webinar this afternoon. For those of you who were unable to attend part 1 of this webinar series, or if you did and you're interested in revisiting some of the material, it has been uploaded to our GRIO YouTube page. After we finish today's webinar, part 2 will be uploaded to our YouTube page as well, and both parts will be available on our GRIO website under the Products and Tools section. Today we have a few presenters that are going to speak. For the first half of today's webinar, Jess Vole, knowledge broker and credentialed evaluator here at GRIO, will discuss the public health approach to gambling that New Zealand has taken to reduce gambling harms. Next, we will have 3 project leads from our BET System Impact projects discuss the local projects they have developed and are implementing, as well as best practices, lessons learned, and future implications from the work they are doing. First, Tanya Healy from the North Bay Parry Sound District Health Unit will share with us some information on their project, Developing Sustainable Gambling Harm Reduction Partnerships and Networks. Then, Susan Pfeifers from Ottawa Public Health will talk to us about their project, Reducing Harms from Gambling Through Community Engagement. To wrap up, Lindsay Klein from Wellington Dufferin Guelph Public Health, one of their projects, Mental Illness and Addictive Disorders Prevention among Grade 7 students, but also briefly share some information about another project of theirs, Preventing Cannabis Harms through a Youth-Driven Campaign. We ask that you please hold your questions until after all of our presenters have finished, as we have a planned 10-minute Q&A session at the end of our webinar. That being said, you will see on the right toolbar a chat function, which has the ability for you to post questions into a Q&A forum. Also, you can message me any questions you have at any time, and I'll make sure they get to our presenters for the Q&A period, again, at the end of our webinar. Without further ado, the floor is all yours, Jess.
We're talking about the pillars of the Ottawa Charter for Health Promotion. And very broadly, this Charter for Health Promotion reminds us that population health approaches need a combination of population-wide and targeted initiatives for high-risk groups. So we really need to be able to adapt our interventions across the population, depending on the needs of the different groups. There's a fundamental acknowledgement of the complex interplay between determinants of health and health behaviors and outcomes. We know that there is so much more that plays into a person's health beyond their health behaviors and the way in which they interact with their physical and social environment. We need to consider interventions and strategies that are delivered across a range of settings and the life course. So being able to intervene and provide health promotion activities across a person's lifespan. And finally, we're looking at simultaneously multi-pronged approaches. So really that understanding that there is no one-size-fits-all. Today, simply due to time, I'm only going to really focus on New Zealand. And the reason I'm going to focus on New Zealand is that they are actually quite progressive and really far, probably the furthest along, arguably, in their public health approach to gambling. In 2003, the Gambling Act was tasked the Ministry of Health with funding and the coordination of problem gambling services. And through this act, there is a strategy to prevent and minimize gambling harm. And they've had a strategy in place actually since 2004, different iterations over the year. And we're currently in the 2016-2017 to 2024-2025 strategy period. So it's a 9-year period. And within those periods, they have shorter service plans, delivery times, in which they can implement and evaluate the effectiveness of different interventions. I included this quote here because I think it really drives home the buy-in and support for a public health approach in gambling that is seen in New Zealand. While effective treatment reduces suffering and problem duration, it has limited impact on the prevalence and much less incidence. This is why prevention, reducing the development of problems in the first place, through a focus on their social and other determinants, is so important. The Act recognizes the importance of prevention and requires the ministry to adopt a public health focus in addressing gambling harms. So as you can see, that's some pretty strong language, and that really frames the activities that are able to happen in New Zealand. The strategy goals have remained fairly similar over the different iterations over the years, but I'm just going to paraphrase them briefly here. One of the largest goals is to achieve health equity, and specifically thinking about the large population of Maori and Pacific peoples that reside in New Zealand. The strategy seeks to maintain a comprehensive range of public health services based on the WHO's Charter for Health Promotion in New Zealand Models of Health. Again, really thinking about those culturally sensitive models of health and conceptualizations of well-being. It seeks to fund service and evidence-based, effective, and sustainable. The strategy funds 5 key service specifications, or delivery streams, if you want to think about it that way. And they are policy development and implementation, and this has to do with engagement with government agencies, social organizations, private industry, and businesses to reduce gambling harm. Safe gambling environments. These are activities that ensure that the environments that provide gambling opportunities are actively minimizing harm, and that individuals in these environments are supported to recognize and seek help if they need it. Effective screening environments seeks to identify individuals that are at risk of experiencing harm as early as possible, so really looking at early intervention strategies. Supportive and aware communities have some overlap. Aware communities really have to do more with the general knowledge, education, and awareness of a community and understanding the potential harms from gambling. And supportive environments really recognizes that communities and individuals can build their resilience and protective factors to reduce their harm from gambling, and it seeks to build capacity in a way that is meaningful to that community. I'm going to cover now 2 evaluations that were recently published, I think in 2017. And these are evaluations that span the 2010 to 2013 service delivery period for the 2010 to 2016 strategic plan. And these fall under the policy development implementation stream, as well as the aware and supportive community stream, which I'll speak to last. So the policy development implementation stream, it has 3 policy focus areas. And those are workplace and organizational gambling policies, non-gambling fundraising policies, and council policies on electronic gaming venues. And really, the implementers in these activities are really encouraged to identify appropriate stakeholder organizations, spanning from councils, businesses, education providers, sports clubs, etc., to work with and develop relationships. Then to educate these organizations on gambling harms and enhance their understanding of policy relevance. And finally, and ultimately, to facilitate community action. So the goal of the workplace and organizational gambling policies is to increase the voluntary adoption of policies to reduce gambling harm among an organization's employees and clients. The main activities that were conducted through this stream were to increase awareness of problem gambling as a possible cause of social, health, and financial issues. And organizations were offered tools and resources to identify and address problem gambling among their clients and service users. And I should mention the targeted stakeholders were quite broad, from social services to correction facilities, mental health services, suicide prevention programs. So the definition of a workplace and organization were quite broad. And essentially, the implementers were looking to understand where these organizations and community groups were at initially, and work with them to build some policies that might bring them to a voluntary adoption of policies to reduce gambling harm. Well, they found that there were some workplace and organizational gambling policies established, but for the majority of organizations and groups, the development of these policies was just not a priority, although implementers did feel there was an awareness of the issue as a whole. And the implementers also acknowledged that having their own experiential knowledge, so having designed and implemented workplace gambling policies in their own environment, was really key to being successful at being able to mentor other organizations to do the same. There were many challenges, including organizational buy-in, so perhaps not thinking gambling was a priority or an issue they needed to be involved in, or perhaps not believing it was really in their purview to focus on that. Resistance to change, so similar to organizational buy-in, but also acknowledgement of the difficulty and potential cost to an organization to implement policies. And ultimately, a lack of a legal requirement. The fact that the policy was meant to be voluntarily adopted actually kind of reduced the effectiveness in it being put into place, simply because it was a lot of work, perhaps not a priority for some groups, and not legally required. The policy efforts around non-gambling fundraising policies wanted to encourage fundraising methods that did not involve gambling, and to also have organizations put forward a stance of non-acceptance of gambling funding. The main activities were focused on community groups, such as sports clubs and church groups, the kind of groups that typically rely on gambling proceed grants and engage in gambling-based fundraising activities like raffles or casino nights. And the implementers wanted to raise awareness of gambling harms and facilitate discussions on alternative funding opportunities. Although the researchers found that there was one organization that did develop a non-gambling fundraising policy in this cluster of organizations, by and large, most were stuck at the attitude shift stage by discussing alternative fundraising methods. One of the biggest barriers were that groups were reliant on gambling proceeds, and with no clear alternative sources identified, it was difficult to move forward in this area. Some implementers also commented that the policy's focus could be controversial and perhaps have unintended consequences. So, for example, if they spent time dissuading lower socioeconomic status groups from applying to the gambling proceed grants, they might actually be exacerbating the sort of chasm or unjust transfer of gambling proceeds in the instance where higher socioeconomic status groups would continue to apply and receive these fundings. So the last policy focus area in the policy development and implementation stream that was evaluated were the council policies on EGM venues. And EGM, if you're not familiar, stands for electronic gaming machine. And the goal of these policies were to have city council members consider community feedback on policies concerning EGM venues' location and distribution. And a popular sort of example, this would be a sinking lid policy approach. And this is when, once a venue closes, no licenses can be issued in its place. So basically, once a EGM location is closed, it's gone for good. And ultimately, over time, the idea behind this is that it would reduce access to EGM venue locations. The two main stakeholder groups in this area were the general public and council staff. And implementers were quite creative in participating in a large variety of activities, from awareness-raising tools, education booths at special events, working with special groups in community meetings, social media engagement, press releases, media interviews, and those sorts of things. And many implementers made substantial preparations to support Council's evidence-based policy decisions. So they found that although these efforts increase public awareness about gambling harm and of citizens' rights to be involved in the Council's policy review, many successful policy decisions did not result. Makers either did not support a sinking lid approach, or they would weaken it by adding a clause that the venue could relocate. Although they did find that, in general, community involvement in the policy process did generate public pressure, and that did at least start the conversation. Some of the challenges they found that the researchers found that there were perceptions among council staff of the opportunity to boost local economic development. So the belief that adding an EGM keeping the EGM location open was important for the local economy made them reluctant to adopt a sinking lid approach. Council members were busy, there were high workloads and competing demands, and a costly public consultation process. And finally, there was a lack of robust processes for collecting evidence on social harms to warrant a policy review in the first place. So really not great systems put into place to determine whether this was something that warranted the retention. I'm going to move to the last evaluated stream now, which was for the aware and supportive communities, which really revolved around building capacity. And this evaluation also took place over the 2010 to 2013 service period. The main activities for the stream were stakeholder engagement with health and social service employees, emphasizing the interrelatedness between gambling harms and other areas of the work. Anecdotally, this is very similar to what we're doing here at GRIO, really looking to position gambling within the broader landscape of other mental health addictions and social determinants of health instead of an issue in and of itself. Similarly, looking at integrating gambling harm messages within programs of interest to these communities. Again, similar to work that we're trying to do here with our BET program, and you'll hear more about that later this afternoon. Really trying to raise awareness where other people are presenting in the system. The development of culturally sensitive public health approaches. Integrating youth messaging and awareness on gambling education within other existing youth programs. And finally, media strategies that encourage community involvement and public discussion. The researchers found that learning how gambling harms were interrelated with other issues really enhanced service providers' understanding. So by positioning gambling within the mental health and addictions field more broadly and maybe it into poverty and homelessness or other issues that were of great importance to service providers, they're better able to understand what their role might be in moving forward in this area and why it was so important. They also found that incorporating gambling harm education and a brief screen enhanced community awareness of gambling harms and also strengthened community or individual level protective factors. And finally, the youth programs were fairly successful in building the skills and competencies needed to develop their individual protective factors and take action in this area. Of course, building capacity is not without its challenges. There are definitely access barriers to working with youth. When we think about culturally sensitive materials, you really need an in-depth knowledge about those communities to develop those, and those partnerships really have to be in place prior to doing that work. We also need to be mindful of the cultural implications of that work. So, for example, thinking about how phrases like at-risk or problem gambling can be viewed as stigmatizing in certain cultural groups. And finally, an acknowledgement that community action programs are resource intensive and they may or may not be sustainable, and we need to be mindful of that. So the recommendations for this policy area were that improving public health outcomes can be maximized by prioritizing programs with greater sustainability potential. And kind of building on that, we really need to make sure that we involve stakeholders via a wide range of approaches, because that's most likely to enhance a program's success. And we should look at an explicit inclusion of program sustainability as an objective in harm minimization programs. And this stakeholder involvement is a means of achieving that. So that's all for me, so I'll hand it back over to you, Alex.
Thank you, Jess. Again, please hold any questions you may have for Jess until the end, or post them in the chat or Q&A boards on the right toolbar of your screen. Before we move on to our next presenter, I just wanted to give a brief overview of what our BET funding program is. BET stands for Build, Engage, and Translate, and this is one of our main programs here at GRIO. The BET program helps to reduce harm from gambling by funding through 3 streams: community initiatives, student capacity development opportunities, and systems-level strategies, again, that target any of the areas related to GRIO's work or gambling harms. And you'll be able to find that information on our website, which is www.grio.ca, if you're looking for any further information. So that is what we are moving into next, is 3 presentations from BET System Impact funded projects. First up, we have Tanya Healy from the North Bay Parry Sound District Health Unit, who will share some information with us about their project. Tanya is a community health promoter at NBPSDHU, that's a lot of letters, who is also a registered social worker. Tanya previously worked at the Canadian Mental Health Association branch in North Bay, and as such has an extensive background in social issues and health promotion. So I will pass the ball on to Tanya, and the floor is all yours.
Okay, great. Thanks, Alex. And thanks for the presentation, Jess. I took some pieces away from that already. So I am, as Alex mentioned, a community health promoter here at North Bay Parry Sound District Health Unit. And I am fortunate to be leading our gambling harm reduction work in Nipissing and area. And our project, funded through the BET System Impact Grant, is called Collaborative Gambling Harm Reduction Plan Development and Implementation. So just a bit of background in terms of how we've arrived here today. So we have an anticipated casino development in North Bay as part of the OLG expansion across the province. In 2016, the Board of Health here endorsed a position statement affirming that gambling expansion has adverse health impacts on individuals, families, and communities, as we know, and that a public health strategy of prevention and harm reduction was recommended. And that endorsement led to a presentation by our Medical Officer of Health to North Bay City Council, encouraging a harm reduction approach to the casino. And there wasn't really any action that came out of that in terms of uptake by the former or current council in accessing public health as a support when considering the potential impacts of a casino and harm reduction strategies that could be planned for in advance. So the more that we learned about gambling and its links to the social determinants of health, we came to understand that a community response was needed. Then came along our opportunity through GRIO, and we began engaging some key partners for an application to the BET System Impact Grant. So our key partners include Canadian Mental Health Association Nipissing, who are really keen on upstream change, and Community Counseling Centre of Nipissing, who are our sole provider of gambling addiction treatment services in our area. And since our application, we've also had the CMHA Muskoka Parry Sound branch come on board, as well as the District of Nipissing Social Services Administration Board. So our project goal is to develop a gambling harm reduction partnership of health and social service providers who will develop a gambling harm reduction plan for Nipissing District and area, and as well as an educational campaign, which will be kind of the phase 1 of implementation of our plan. We've chosen to focus on the health and social service sector in this work, just so that we can have so we can be better organized when reaching out to other stakeholders and have our common messaging nailed down before reaching out to other sectors. So our vision for the plan is really to create a document that identifies priority actions under primary, secondary, and tertiary prevention related to gambling harms. So this may range from collaborative work on improving the social determinants of health, so that kind of that more upstream work, and incorporating our gambling harm reduction work into policy work that we're already doing in terms of the social determinants of health. It could be public education, assessing and improving screening practices, and promoting and growing available treatment services and support for those affected by gambling harm. So these are a couple of GRIO-produced documents. If you've not seen them yet, you can find them on their website. As part of our plan, we will clearly identify our priority populations based on our local data, and we'll also aim to demonstrate how the social determinants of health are linked to gambling harms locally. So on this slide, we have the gambling harms mind map created by GRIO, and what we plan to do is create a locally adapted version which visualizes gambling harm and the way in which harms are distributed across the population. So we want to add in our local statistics where available for our health unit region, and use this as a bit of a visual snapshot to share how the social determinants of health are linked to gambling harm in our area. And we can use that in sharing with the public, service providers, municipal decision makers, and eventually the casino operator. So how are we planning to develop this plan? So our first course of action is recruiting key stakeholders and engaging health and social service providers. So I'll tell you a bit more about our progress on that so far in a moment. We're developing a gambling harm reduction plan collaboratively, and we are aiming to inform the general population and priority populations of harms associated with gambling. We want to encourage help seeking because there's very low uptake of treatment services and a lot of stigma acting as a barrier to accessing services for people. And we'd like to prompt the public to support policy action. So this inform bullet is really around our promoting our plan as well as our educational campaign. We also plan to connect and share the plan and our efforts with the broader community through a community forum. So one of our first activities that we hosted here was on November 6th. We hosted a knowledge exchange event for health and social service providers. And the purpose of that event was really to provide a venue for conversation that to this point really hadn't happened around gambling in our community generally, so all types of gambling, but then also even in light of the casino being developed, there hadn't really been any strategic community organization around the topic. So we also aim to build capacity among health and social service providers and place gambling, like as Jess was mentioning in her presentation, place it in context, so provide some meaning to people and link it to the work that they are already doing in whether it be housing or income or domestic violence. So kind of helping to establish those links. And as well, we wanted to use the event as a method for recruiting members for a gambling harm reduction partnership. And we had a few presentations. Our medical officer of health presented on our local picture in terms of gambling here and some of our vulnerabilities in terms of our social determinants of health. Alex and Jess of GRIO kindly presented on a public health approach to gambling harm reduction, and Dr. Sasha Stark from the Center for Advancement of Best Practices through Responsible Gambling Council attended to talk about what makes an effective education campaign, some of the work that's happened through RGC. We also had a fair bit of facilitated discussion, so we really wanted to kind of draw out and understand the problem. So what we what we already know about the problem and what questions we need answered to better understand the problem. And to ask folks about what a public health approach could look like in North Bay and Parry Sound area, and identify some small wins or low-hanging fruit, as well as some longer-term goals, which GRIO kindly lent their expertise in facilitating a lot of discussion that day. So a bit on what we heard from that day. So there's really been a lack of local commentary and organizing and communication around the topic of gambling. We have one service provider that is the sole provider, Community Counseling Centre of Gambling Addiction Treatment Services. And other than that, we kind of learned that the service community expects that they're feeling the impacts of harms associated with gambling, but they're not necessarily even asking questions about gambling. So maybe some screening issues. There was a clear recognition of the vulnerability of our communities in terms of how our communities experience the social determinants of health. So if we think about the priority population of older adults, for example, our population is older compared to the Ontario population. We have a higher population of Indigenous people who are identified as being at increased risk of experiencing gambling harms. In terms of mental health, we have higher rates of stress and mood and anxiety disorders. The list kind of goes on and on, but basically we have a vulnerable population here, and service providers were clearly expressing that. We also have a strong and connected health and social service sector that collaborate really well. And so in Nipissing District fashion, the group really expressed a clear desire for collaboration and action around preventing and addressing gambling harm, which is ultimately what we wanted out of that day. Some of the low-hanging fruit that folks identified were networking and partnerships, data sharing and monitoring our community's wellness in a better way, public education, improving screening practices, promoting treatment services. Some of the longer-term goals that were identified were improved social determinants of health, reduced stigma, comprehensive services for those affected by gambling, ongoing relationships with municipalities and casino operators around the topic of gambling, and advocacy on a provincial level for improved regulation of advertising. So some of our next steps include continuing to grow our gambling harm reduction partnership and really engage those folks that came out to our event. And we want to learn from other casino host communities. So if you are on the line and you want to reach out, I'd really appreciate that. We will also be looking to build relationships with stakeholders outside of the health and social service sector. So we'd like to have some conversations with people with lived experience, community activists, and municipalities, and start to kind of warm up those relationships. We'll establish our priority populations based on our local data and identify a target audience and key message for our educational campaign, develop our plan, and plan for sustainability and next actions following our 1 year of funding through GRIO. So thank you, and if I would love to connect with others. If you feel like it would be helpful for you to talk to me, or if you think I have something to gain from you, please reach out. My number and my email are there. Thank you.
Awesome. Thank you very much, Tanya. When Jess and I traveled up to North Bay as part of the event that they held at the start of November, it was a really good turnout. They had a very diverse group of stakeholders in the room, and there were some really, really good discussions on kind of how to start building the capacity of their local network to respond to the incoming gambling venues and potential gambling harms associated. Please again hold any questions you have for Tonya until the end, and we'll be able to post them in the chat or Q&A boards again that are just on the right side of your toolbar. Next, Susan Fivers from Ottawa Public Health will share with us some information about their project. Susan is a public health nurse with extensive experience working in the public health unit in Ottawa as well as the Ottawa Hospital. So I have shared the screen over to you, Susan, and unmuted your mic. So the floor is all yours.
Okay, thank you very much, Alex. So again, I'm Sue Fipers, or Susan Fipers, and a public health nurse with Ottawa Public Health. And about 1.5 years ago, I picked up the file on gambling, so I've had a very steep learning curve since that time. So I'll just start with our project, Reducing Harms from Gambling Through Community Engagement.
Sorry, Susan, I just have to interrupt you for a second. We're not seeing anything come up on your screen yet.
Okay, hang on. Let me escape. How's that?
There we go.
Is that better?
Thank you. Yep.
Okay, perfect. And I'll just open it up. Can you see everything?
Yes, that's perfect.
Okay. All right. Okay, so I'll just skip to the next page. There we go. So just a little bit of background of where our project came from. So back in April, we did a Board of Health report, and consultations revealed concerns from community partners. And these concerns were linked to the limited amount of local prevention messages and awareness of treatment and support services. And they are linked also to something Tonya had mentioned in her presentation, but a gap of the people seeking treatment as in comparison to the estimated prevalence rate of problem gambling. So, for example, in Ottawa, we had about 540 people seek treatment for problem gambling in 2016-2017. And with the estimated prevalence rate of 1% to 2%, that could be upwards of about 15,000 people in Ottawa. So there was quite a gap. And we also noticed that we had limited information on the scope of the problem in Ottawa. We did know, we do know that there are certain groups that are higher risk and certain groups that have more vulnerability to harms from gambling. So we made a recommendation to our Board of Health that included 4 points. And one of the points was community engagement with these high-risk groups. So community engagement is really going out directly to the groups to discuss and share information and solicit feedback. We really wanted to gain a clear understanding of how these different groups were experiencing gambling and harms from gambling. So really it's a way to directly link to the various groups and the priority groups in the community and really incorporate their experience into our interventions. So community engagement principles is considered a best practice in terms of public health interventions, and research has shown that community engagement can have positive impact on a range of various health outcomes. And it's very effective in reaching those hard-to-reach groups through intermediaries that are already supporting those populations in the community. So 2 big project goals, reaching for the stars, is to improve the well-being of populations at higher risk of harms from gambling by strengthening the outreach and increasing awareness and prevention messages of the harms in those communities. So really that's part of our capacity building and community engagement part. Another part is embedding gambling harm reduction strategies into existing community services and mental health, substance use, and addiction initiatives that support vulnerable populations in Ottawa. So a couple of the strategies that we're using. The first is leveraging the expertise and resources of the Ottawa Gambling Harm Prevention Network. So this was a network that was part of our recommendation to our Board of Health in establishing a group in the community made up of various partners. So partners do include industry, so the casino operators, regulators, which would include OLG, organizations such as Responsible Gambling Council, and then our treatment providers and support service providers as well. Now, the mission of the network is to work together with all the partners to raise awareness about the harms from gambling, to help people make better decisions in regards to gambling, and to implement plans to prevent harms in Ottawa. So where we're at right now with the project, I'm sort of at the consultation part of the project with treatment partners. So I've gone out to a few different groups who are in treatment and recovery from problem gambling. And then the next steps would be reaching out to intermediaries who are supporting priority groups or high-risk groups in the community. And out of that, we hope to develop resources based on new knowledge from our community engagement, and then integrate messages of gambling awareness and prevention information into the established mental health, substance use, and addiction initiatives such as stigma reduction, and into those activities that are already taking place in the community. So lessons learned so far, planning. I always find that planning does take a little bit more time than anticipated. And one of the key parts of our activities was leveraging the expertise with the Ottawa Gambling Harm Prevention Network. And they're a relatively new initiative. So the network just started back in June. So therefore, as a group, we're still setting up processes and priorities and action planning. So to integrate the community engagement project that was funded by GRIO into this took a little bit longer to plan than anticipated. And finally, some potential outcomes. So we're really hoping that our consultations with priority groups and key stakeholders really give us a good understanding of what we need to do to support higher risk groups. That consultations inform future planning of the network. So really, we're leveraging the expertise of the network, but we also want this to help direct the interventions of the network. Improved awareness among OPH programs, so really starting internally first and then expanding out into community partners and service providers in the harms related to gambling. Potentially new community agencies involved in sharing this information. Increase in community partner engagement, so people out there actively working on projects that reduce harms from gambling. And then increased knowledge about gambling treatment and support services by intermediaries supporting vulnerable populations. So this is the part where we really hope to reduce the stigma and increase the help-seeking behavior so that people know that there are treatment and support services out there to help them. And that's it. Thank you very much.
Awesome. Thank you very much, Susan. Again, if you have any questions for Susan, please hold them until the end or post them in the chat and Q&A boards on the right toolbar. Next, Lindsay Klein from Wellington Dufferin Guelph Public Health will be sharing some information about their project. Lindsay is a health promotion specialist at Waterloo Dufferin Guelph Public Health, who previously has worked in research as part of her PhD in behavioral and population health at Brock University. So I believe we have switched the screens over, and I will unmute Lindsay, and the floor is all yours.
Okay, thank you, Alex. I'll just get set up here. So yeah, as Alex mentioned, we were involved with a project here at Wellington Dufferin Guelph Public Health, where we really wanted to take a bit more of a well-rounded approach to looking at gambling harms, and really wanted to embed the aspects of mental health and substance use as well. So that was kind of the birthplace for our project ideas here at the health unit. So the purpose of our
our project, we really wanted to, before we dove right in and developed a comprehensive, widespread program, we wanted to really pilot test something to make sure that it worked in our local context before rolling it out as a larger scale project. So the purpose of our study was to deliver the pilot test version of a comprehensive evidence-informed program that was teacher-led and really, like I said, tackled mental health, substance use, and addiction, including gambling, as one and not separately. And we thought that it aligned perfectly with the GRIO approach to embedding gambling for the public health lens. And we partnered with a local group called the Dufferin Coalition for Kids, and they have an action group there that's really tackling these three issues together with mental health, substance use, and addiction prevention. And so these include our two school boards as well in the area. So they looked at various different programs that related to this type of content, looked at all different aspects of this, and came up with the best program that we wanted to move forward with. There we go, which is called Stress Lessons. And it's a program that was developed by the Psychology Foundation of Canada, and it was designed in collaboration with educators, counselors, psychologists, and the program itself is really looking at a primary prevention approach. So this is a program that's relevant to all students, not just targeting students that are experiencing issues with stress. And it's really about creating teachable moments for students to address stress management as it relates to all different aspects of their life, and building emotional resiliency, and helping students understanding when stress is considered a normal amount and when it's time to actually seek help, that it's becoming an issue or a bigger issue. So our pilot project, we started in October of this past fall. We recruited 105 grade 7 students as part of our project that included 6 elementary school teachers. And these came from 3 different schools up in our Dufferin County. And so in early October, we held our teacher training for all the teachers that were going to be involved in the program, which I'll touch on in a little bit here. And then at the beginning of November, we completed our first survey with all the participating students to just get a baseline level of where they were at on certain indicators, which I'll expand upon in the next few slides. And then we decided to do something a little bit different in that we wanted to implement a phased aspect to this program. So in phase 1, so running from October to early February, we were going to have 2 schools implement the Stress Lessons program. And one of our schools is just going to continue with their regular curriculum, and really using this as a way to kind of compare whether any effects that we see with our students with the survey data, whether that we can attribute that more to the program itself or simply just time passing by with the curriculum expectations that the teachers implement on a regular basis. And then in early February, we're going to do the survey again that we'll use as a post measure for those students who implemented the Stress Lessons program, and use as a baseline level then for those students who in phase 2 will be running the program. So the school that didn't get the program in the first phase will now get the Stress Lessons program with their teacher in the second phase of our project. And we're also looking to run teacher focus groups as well with those teachers who implement the program both in phase 1 and in phase 2. And then at the very end of April, we're going to be doing a third survey with all participating students as well, and looking to really measure those retention learning effects that might be happening from our students that receive the program in phase 1, and then with our students that receive the program in phase 2, using that as their post measure to see how there were any differences in their indicators based on receiving the program itself. So as far as the trainings the teachers received with Stress Lessons, we hired the lead trainer for the Psychology Foundation of Canada to come in, and she ran a full day training with our teachers in person, and she really took the teachers through the program itself and made sure that they were comfortable with the material, and really emphasized that this is a program that is meant to start conversations. You don't need to be a mental health expert to implement this in your classroom. It's really about providing students with the skills and the platforms to talk through these issues. And so we went through all 7 lessons of the program with each teacher, and they had an opportunity to practice some of the activities that they'd be running with the lessons in their classroom. But to make sure that we really embedded that gambling harm aspect, we chose to take lesson 5, which is focused on making positive choices. And what we did is we tweaked one of the activities that was focused on problem solving, and we created 2 scenarios that the teacher was to use in their class as a group example. And then we consulted with our mental health leads and our curriculum experts at both school boards, and also with the folks at GRIO to make sure that the scenarios fit with what we thought would be appropriate content for grade 7 students. And so the 2 scenarios that the teachers can choose to run through with their classrooms are really focused on youth using gambling or gaming activities as a potential way to cope with stress, and how there can be some of the negative repercussions that happen with using these types of activities to cope with feelings of stress in their everyday life. So just as an example, our 2 scenarios that we came up with, one of them talks about a girl in grade 7 using Candy Crush as a way to kind of cope with some of the stress that she's experiencing in her life as an escape. And the idea of bringing in that gambling aspect with the loot boxes that she could purchase. And the second scenario is looking at a grade 7 boy who has kind of playing too much of the multiplayer online games, and it's really affecting his everyday life, but doesn't know how else to escape or deal with that stress. So really providing these platforms for the teachers to talk through these issues with students and putting it back on them of how they would break down the problem, and what are some of the other ways that these students and themselves can implement different ways to cope with stress that might be a bit more adaptive than the ways that they might in these scenarios. So with the surveys that we're going to be running with the students, the 3 measures that we're looking to assess over the course of the project are looking at the perceived stress levels that these students have, and looking at their self-efficacy as well. But what we're mainly looking at is their coping strategies. So looking at what kind of coping styles are these students using to deal with stress in their everyday life. So are they more active levels of coping, so things like problem solving or reframing a situation, avoidance coping where they're looking to kind of hide away from the problem, distraction coping, so doing other activities to pretend that those coping or those stresses aren't there in their life. Or are they seeking support, and who are they seeking support from? So really looking at how students are dealing with stress in their everyday life. And then with our teacher focus groups, it's really looking at some of that process information. So with implementing the Stress Lessons program specifically, what was easy, what was challenging, what fit well with the curriculum, did they observe any changes in their student behaviors with the lessons as they went on? So these are the things that we're going to be using to inform some of that broader rollout that we're hoping to use this pilot project for, with implementing this at a broader scale across different grades and different schools within our geography. So some of the knowledge pieces that we're hoping to produce from this pilot project are looking at creating an interactive data report. So our health unit has been starting to move away from the idea of a static data report or a summary report, and really getting into this idea of that interactive piece where we can have something housed on our website that the user can kind of move around and interact with the data and pick and choose what would be relevant to them. So we're going to be creating a data report with the results from our student surveys with that we'll share with our schools and teachers that participated in the program, and also with the mental health promotion community of practice. That's a group of public health individuals who are involved in mental health, and kind of sharing it as a lesson learned that maybe other health units could use as well. And then from the focus groups and the training with the teachers, we're hoping to produce a bit of a training supplement document that the Psychology Foundation of Canada might be able to supply with other teachers who are going to be using this program in their schools as kind of lessons learned or best practices that they can incorporate when they roll out the program in their classrooms. And just lastly, I wanted to mention one of the other, we were lucky enough to receive 2 GRIO funding opportunities. And so my colleagues here at WDG Public Health were working on a cannabis information campaign where they were really looking at wanting to increase awareness and knowledge about the health effects of cannabis use and how we can reduce some of the harm that might be involved with that, especially with youth. So they did a great job with engaging youth through the whole process and created videos and a website, and I urge you to take a look at their website, which is listed at the bottom there, talking about weed.ca, and they've got great information on there about some of the relationships between gambling harms and cannabis use and how we can just be aware of how those are linked. So I urge you to take a look at those videos and the website content. And just lastly, thank you for listening, and thank you to GRIO for providing us with the funding opportunities and really making it possible for us to engage in these projects with our local community. And my email is there if you have any further questions about the project or want to chat more about other initiatives. Please feel free to reach out and contact me. So thank you.
Thank you very much, Lindsay. It's nice to hear about both of the projects going on in Wellington, Dufferin, and Guelph. Before we move on to our question period, I just wanted to remind everybody that you can use the Q&A function on the right toolbar to send any questions to me, and if they're specific, I'll make sure they get directed to the appropriate presenter. I'd also like to thank our presenters once again for taking the time out of their day to share with us the projects they've been working on in their area and some of the potential outcomes that they've seen already. I'd also like to say if you missed any of the contact information for any of our presenters, my email is alex@grio.ca if you have any questions or follow-up comments related to anything that was presented in the webinar today. So we'll open up for questions. Okay, none from our audience so far, but I was wondering if Susan, Lindsay, or Tanya, any of you would be able to kind of briefly talk about, I know some of you mentioned it briefly in your presentation, some of kind of the potential challenges or barriers to maybe getting your project started or that you've kind of had in your local context in terms of getting this off the ground. I've unmuted all of your mics. And we actually have had a question come in from the Q&A from someone in the audience. For Tanya, Sarah List was wondering if there are any plans to engage the operator in your stakeholder consultations.
Yeah, hi, thanks for the question. Yeah, we do plan to reach out. We need to determine as a committee when that will take place. We're really focused on really just gathering, kind of getting our ducks in a row in terms of our health and social service community. But I do think it will take some time maybe to develop those relationships, so we would like to see that get started. I'm just not sure exactly when that will take place.
Awesome, thank you. Okay, well, it looks like that is all. So we're going to wrap up. Again, thank you everybody for attending today, and thank you again to Lindsay, Susan, Tanya, and Jess for their presentations. Again, if you have any follow-up questions or comments related to the webinar, Part 1 or Part 2, you can email me at alex@grio.ca. As well, since the part 1 of the webinar series has uploaded on our YouTube page, and Part 2 here has been recorded and will be made available online as well. So look for that to follow up in case you potentially missed the start or any of the presentations. And that's all. Thank you all and have a good afternoon.